Hi, my name is Josh. I own a personal training gym, and for the last decade plus, I've spent over 30 hours a week on the floor training clients and members. And today we're going to talk about training when you are on a drug that aids your weight loss. Drugs that aid weight loss, things like GLP-1s, are becoming very prevalent in both gym culture and also popular culture. And this past year or so has been the first time that we've really seen them start to become a little more prevalent in the gym. Today, I'm not going to talk about taking them or dosing them or sort of speculating on their benefits or health effects or anything like that. We're just going to talk about training and some of the things we notice and how you can optimize training, because exercise is still important even when you're losing weight with a little bit of help. And so we're going to talk about optimizing training when you're using a drug like this. At the end of the day, you don't want to change your training too much, if at all. One of the big things is a drug that aids weight loss is just that. It's going to aid weight loss, but it's not a miracle by any means. It's going to help you lose weight in the same way that a regular period of caloric restriction would help you lose weight. So the mechanism is essentially the same. When we go on a regular diet that involves caloric restriction, one of the things we always tell people is you don't want to change your training too much. The big thing with retaining muscle tissue, which is the goal that most people have, is that your training needs to be intense enough and resemble, quote, normal training as much as it can in order for you to preserve as much muscle tissue and have the best end result that you can possibly have. So if we're talking about optimizing training when you're on a drug that's going to aid your weight loss, there really isn't too much to change, but there are a few things to think about. One of the questions we get a lot when people go on diets is, I'm having trouble, or one of the concerns is that they'll say, I'm having trouble hitting my protein goals. I'm really concerned about my muscle tissue. And at a certain point, when your protein is perhaps too low in a period of caloric restriction, then we probably do need to worry a little bit about saving muscle tissue through the diet. But what's probably more important than protein intake alone is your training. And I say this because if you go through any period of really high protein intake, it doesn't necessarily build muscle if your training's not there to support it. One of the biggest changes we see when folks jump on diets in general are periods of caloric restriction, and that includes when someone is using a drug that's going to help them lose weight, is much greater levels than normal of fatigue. We see that people are more likely to be injured, they're more likely to have nagging pain, they're more likely to be tired during the day, they're more likely to get sick, and they're just more likely to miss workouts in general. Here are a couple things you can do to sort of offset those normal effects of caloric restriction. The first is that in a period of caloric restriction, since your energy intake is lower, a lot of times your motivation for working out will be a little bit lower. So I would encourage you to find a program that you really enjoy doing, or tweak the program you have so that you really enjoy doing it and you look forward to going to the gym. Because missing your workouts is much more detrimental than switching to something else at the moment so that you can continue to train through the period of caloric restriction. The second thing is, when you are in the gym, try not to scale back your intensity too much. A lot of times when folks are dieting, they'll want to get more volume in because it'll feel like you've done more work, or sometimes you'll be tired and you'll have trouble getting into higher intensity work without feeling super fatigued. But you don't want to pare your intensity back too much, because that won't be super productive for maintaining muscle. So what we want to do is, we would rather see people reduce their volume a little bit instead of trying to increase reps and sets and do more. We would actually rather see people maybe reduce their volume by a small amount to make sure that they can maintain their intensity. So a good example of that would be, if you're doing exercises and you're used to doing sets of 6 or 8 or 10, when we're dieting, we don't want to see you jump to 15, 20, or 25 or something like that just to get the extra reps in. We would rather you maybe do 3 sets instead of 4, or 2 good sets instead of 3, but maintain those lower rep ranges and the higher intensity. The third thing to remember is that it's really important to try and strike a balance with the overall volume of your programming, especially if this is the first time you've ever been into a deficit where you're feeling a lot of fatigue and just maybe a little lethargic. One of the things that people will do when they go all in on a diet is they'll like to add in a lot of especially extra cardio to their routine to try to take weight off faster. And what we want to make sure that we do is we want to balance our routine so that we are getting our strength training in, because again, preserving muscle, best done through training, is really important to the end result that you're looking for. Again, for most people, we're not just looking to lose weight, we're looking to lose fat and change our body composition. And so if you're doing so much volume with cardio that you find that you don't have the time or the energy to do your strength training, then we want to better balance the program out a little bit. So it's not just about maybe paring back strength training sets if you're fatigued when you're doing your strength training, but it could be a matter of trying to find a balance where you're not overly fatigued by both the diet and the amount of cardio that you're doing on top of it, and so you can't actually really functionally strength train in the first place. I guess the last little tip, going back to where we started, is make sure that you are taking in adequate protein, especially if you're not hungry and your hunger is really controlled, which is something that usually comes up with diets, and a weight loss drug is going to prevent that to an extent. If your hunger is really controlled, you might find that you are really, really low on protein. So make sure your protein intake is where it needs to be for yourself individually. And then above all, you just want to stay consistent. Training is, as I said in the beginning, the most important thing when it comes to retaining muscle and just keeping yourself in shape. You don't want to lose all your fitness in the quest for weight loss, because then you'll be stuck on the other side trying to rebuild all of it. It can take a lot longer to build muscle than it takes to lose fat for some folks. And so above all, just try to stay consistent with your routine as best you can. And sometimes that does mean modifying it to the extent that you can maybe change the volume of the cardio or maybe how much work you're doing. But you want to try to maintain your intensity, maintain your consistency in the gym every single week, because training is the most important thing when it comes to maintaining muscle mass and bone density and things like that. So after all of that, I guess the conclusion really is you don't need to change too much if you are going to be using a weight loss drug or a drug that's going to aid your weight loss. You need to stay consistent the way that you normally would, keep your intensity up the way that you normally would, and balance your fatigue. You might find that there's a little more of it, but we would normally tell you to balance your fatigue and energy in the first place. So keep those things in mind, and you'll have great success.